KNUST Wellness Centre, in collaboration with the College of Arts and Built Environment, organizes health and training workshop. KNUST Wellness Centre collaborated with the College of Arts and Built Environment to organize a 2-day health and training workshop for senior members, senior staff, and junior staff at the College of Science Auditorium. This training workshop was to boost their health conditions, nutrition, and how to manage some chronic diseases. The Dean of the Faculty of Arts and Built Environment, Professor Amos, gave the welcome address.
On behalf of the Provost, the role of the committee in organizing this workshop is much appreciated. Colleagues, you are all encouraged to take advantage of the content of this workshop and, of course, opportunities being offered to us to ensure that our activities are health-focused and, most importantly, to stay healthy always.
Dr. Nana Abrakwa from TEK Hospital presented on chronic disease management, where she highlighted on diabetes, hypertension, prostate cancer, breast cancer, cervical cancer, and the services provided by the KNUST hospital.
Great. So what is a chronic disease? A chronic disease is a disease defined broadly as a condition that lasts 1 year or more and may require ongoing medical attention or limit activities of daily living or both. So it's a condition that usually lasts more than a year and might require ongoing medical attention or limit activities of daily living or both. And that's according to the CDC, the Center for Disease Control. Now, these are a few facts for us. According to the WHO, non-communicable diseases or chronic diseases kill about 41 million people each year, and that's equivalent to 71% of all deaths globally.
The second presentation was done by Dr. Mary Ejapon, who is a nutritionist, registered dietitian, and a lecturer at the Department of Biochemistry and Biotechnology.
Someone mentioned food as medicine as consuming balanced meals. Well, yeah, consuming balanced meals very important, but it gets to a point where we consider nutritionally adequate meals. That's we consuming enough proteins, enough carbohydrates, enough fats and oils, and also healthy fats and oils as well. And also, dietary requirements has a lot of issues, especially when it comes to the age. Most of the time, when it comes to consuming meals, people are not so careful. If I look at the auditorium, at least we are all in the age, I'm assuming that we are all in the age bracket of 30 years to at least 60 years. We are all in the same age bracket, but there are some people who may have different dietary consideration. Example, if somebody is diabetic, somebody is hypertensive, or even if somebody has a family condition or a family history of these conditions, they can tailor their diets at least so that they will prevent or they can avoid developing some of these complications.
Participants were taken through some aerobics and were encouraged to do several at home.
Tech TV. Experience educational television.